What we learned in Chapter 1 from Drugs and Society, the 13th edition, is drugs don't discriminate. They don't care what race you are, the color of your skin, your age, or your gender. We do know that the race of drug offenders vary greatly by type. Blacks are 88% of crack cocaine offenders, Hispanics or Latinos are 54% of powder cocaine offenders, and whites were 48% of methamphetamine offenders. Methamphetamine. What is it? What's the definition? It's a synthetic drug with more rapid and lasting effects than amphetamine. It is used illegally as a stimulant and as a prescription drug to treat narcolepsy, some cases of child ADHD, and to maintain blood pressure. Besides the definition of methamphetamine, what really is it? I mean, it's a substance, illegal, of course. It's available as a white, odorless, bitter, crystalline powder that is sometimes injected, taken orally, snorted, or smoked. It's more popular than cocaine and is referred to as speed or crack. It is highly addictive and lasts much more longer than cocaine. Hansen, Venturelli, and Fleckenstein state that they consider it the poor man's cocaine because a dose cost about $10 to $20. You want to use methamphetamine? Think about the risks and the consequences that could come with it. There's a lot of negative ones. One is an addiction. Chronic abusers? Yeah, they'll exhibit symptoms that can include significant anxiety, confusion, staying up multiple nights without getting any sleep, complete mood changes, and violent behavior. Yeah, you can also end up displaying some kind of psychotic feature like paranoia, visual and auditory hallucinations, and delusions, like feeling that bugs are underneath your skin and you're scratching away and picking at them. Psychotic symptoms, they can last sometimes for months, years, even after you've quit using methamphetamine. And when you get stressed, it's been shown to precipitate spontaneous reoccurrence of the methamphetamine psychosis in formerly psychotic methamphetamine abusers. The danger is not just to yourself, but to the firefighters who have to come in and take over a meth lab that may have exploded, or the police officers that are there trying to control them when they're out of control using the drug. Using methamphetamine, it'll affect your body. It'll affect your brain mainly. There's significant change in the brain when you're abused the methamphetamine. Neuroimaging studies demonstrated alterations in the activity of the dopamine system, and that is associated with reducing our motor skills, impairing our verbal learning. We also found studies of chronic meth abusers revealed severe structural and functional changes in our area that actually deals with our emotion and our memory. And that could account for many emotional and cognitive problems observed in chronic meth abusers. That's something that you may not want to have to deal with. You want to use meth? Think about the physical effects that everybody's going to see. Tremendous weight loss, severe tooth decay or meth mouth, and skin sores. Not only that, the death. Death can occur from overdosing or receiving tainted product. If all the information about meth that I've provided doesn't persuade you not to use it, maybe a recreation of an 80s commercial on a campaign to stop drugs will change your mind. This is your brain. This is your brain on drugs. Any questions?